I want to extend a very warm welcome to our Honourable Minister of Health, Yang Berhormat Datuk Seri S. Subramaniam. Your understanding and clear support for our cries for health was noticed by the powers that might be, and some concessions were eventually made. Even in the last budget announcements late last year, there were some further concessions, and we know, Datuk Seri, that you had a silent role in pushing for this. We thank you, sir.
And Berbahagia Dr. Jacob Thomas, President of APHM, Dr. Amiruddin Abdul Sattar, Vice President of APHM, Wan Sushila Devi, Deputy CEO of Matrix Malaysia, Wan Shireen, CEO of Malaysian Healthcare Travel Council, members of the foreign embassies and foreign missions, speakers who have come from various parts of the world to enrich in this Congress, members of the press, ladies and gentlemen. First, I would like to congratulate APHM on this 24th convention, International Healthcare Conference and Exhibition, which you're organizing, and like what Dr. Jacob Thomas said just now, next year will be their 25th anniversary, a major milestone for private hospitals in Malaysia and for the contributions they've done towards healthcare in the country as a whole. And I also would like to thank Dr. Jacob Thomas. I didn't intend to offend him last year when I told him not to make a policy speech. But having actually made a very concise presentation of the state, the affairs and the needs of the private sector at this present moment in time. Needless to say, ladies and gentlemen, the private sector in Malaysia has contributed tremendously in a synergistic form towards the public sector in the delivery of healthcare. And if you look at the Malaysian healthcare system in the current scenario, we have a lot of achievements. I was in Geneva last week attending the World Health Assembly, and it is actually nice to note that amount of international recognition which has been given to us in the process of healthcare. And there are many countries in the world who are looking towards our experience, our expertise, and the way we have delivered our healthcare system from independence to now. So this is a great achievement. I think, needless to say, Malaysia has been recognized as one of the best health systems in this part of the world, having good outcomes, and having solved most of the fundamental aspects of healthcare. We have reduced infant mortality rate to a very a level which is highly appreciated. We have reduced maternal mortality rate to a level which is highly appreciated. We have got very strong child health facilities in our public sector. Every Malaysian has got a health facility within 5 kilometers of where they live, even in the remotest of villages. And these are all achievements which very few countries in the world have actually achieved. And this is very important because once we have got the infrastructure and the network of health system, then it allows us easy access to the people as large in the implementation of policies pertaining to health. Well, that's all the good points. Of course, we have got our challenges. The challenges of the healthcare, of course, is the long-term financial sustainability of the healthcare system, particularly in the public sector. As you all know, if you take the expenditure towards healthcare as a whole in the country, as what Dr. Jacob Thomas said, that we spend about 4 to 4.5% of our GDP on healthcare, which of course is more or less the same as most other countries in ASEAN, except for the more developing countries, the countries which are just developing, like Vietnam and Thailand, which tend to spend a bit more on GDP than we do. But compared to the more developed countries of the world, like Europe and America, of course, our expenditure of healthcare on GDP is still considerably less. I have said that we probably have to spend 6% of GDP on healthcare to ensure the financial sustainability of our system in the long term. And of our total expenditure of healthcare, 55% is by the public sector and 45% is spent in the private sector. And the unfortunate part of expenditure in the private sector is a bulk of this expenditure is what we call out-of-pocket expenditure from the patients themselves. If you ask any person, any health economy, they will say out-of-pocket payments are not good ingredients for the long-term sustainability of the healthcare system. Our figures last year showed that about 35-36% of total health expenditure is out-of-pocket. And that leads to what we call potential health catastrophes, because there could be situations where people are ill, but they don't have enough savings to meet up to the expenditure of that. And this is a challenge which we have to meet. And according to reports from WHO and other agencies, any country in which the out-of-pocket expenditure is more than 15 to 20% has got a greater risk of leading to health-related financial catastrophes. So taking this into mind, we have to find some solution by which we can reduce this out-of-pocket expenditure by patients. That being one challenge, the other challenge is, of course, the demography of our population. We are slowly becoming an aged population. Lifespan of Malaysians is now reached about 74 years. More for women, I think about 77, 77.3. Lesser for men, about 73. Averaging about 74, 74.5. This has got its challenges. As people become older, they tend to use healthcare facilities more. And yesterday in the World Economic Forum, on a panel on universal healthcare in which I was participating, one of the speakers brought this issue that in private health insurance, studies show that bulk of the expenditure through private health insurance actually goes towards the last 15 years of life. So these are challenges which we will face as time goes by, when people tend to spend more and more money towards the later part of life. So if your age is going to be 75, then you're starting to spend after the age of 60. That's when the peak of healthcare spending comes. And unfortunate part of it, that is the part when your income and the ability to generate income is the least. So the expenditure of health peaks at the time when your capacity to generate income is the least. So how do you manage this duality of this healthcare phenomenon? That's a challenge. So these are areas in which we also have to look into. And to add to that is the burden of diseases which we are facing. Our National Health Morbidity Survey for 2015 is ready. I think next week I'll be having a media conference on that. Probably we should invite the private sector to participate in this, to know what are the problems as far as we face as far as morbidity goes. We have got very unfortunate figures. The prevalence of diabetes of about 17.5%, out of which we think about 9% already diagnosed, 8% undiagnosed. They are in the community having diabetes, not knowing their diabetes. We have got about 30% over hypertensives above the age of 18. And we have nearly about 17.8% of Malaysians obese. By the definition of obesity, that is 2 standard deviations above the BMI. And we have got nearly another 30% who are overweight. That means after every 2 Malaysians, 1 is either overweight or obese. And that is not something which is good for the demography of a country. And you know what are the repercussions of the health consequences of the nation. And we have got nearly 47% of those above 18 whose cholesterol is higher than the permitted level. So these are very, very big challenges. You've got an obese, high cholesterol, potentially high diabetic nation. So how are you going to meet up to these challenges? Because this is where the future health problems are going to come. So in our health challenge will be how you're going to manage this chronic diseases. And all our evidence shows that the management of the chronic diseases in the private sector compared to the public sector is not all that satisfying. The reason is the person who chooses, that's mainly in the primary care of the public sector, private sector, not so much in the. There will be a small percentage who will probably use the private hospitals as choice managements for chronic illnesses. But once out-of-pocket payment is a mode upon which they're going to seek treatment for chronic diseases, then the tendency for the patients to use the facility is when they have money and not on a regular and continuous basis. Because of this singular setback, our study shows that the continuity of healthcare to allow for optimum management of chronic diseases in the private sector is still far from satisfactory. Whereas in the public sector, you don't have the burden of payment on your shoulder. There is a greater compliance, and the key results which we are seeing shows that there's better outputs and better results in the public sector. So this is a challenge. So long as the mode of payment continues to be out of pocket in the private sector, then we will be always faced with the non-efficient management of chronic diseases in the private sector, which will lead to greater complications as years goes by.